So I'm thinking back actually, and this is resonating so much that I read so much about and actually wrote about prisons and nursing homes, but we wrote very little, I think, or we heard very little about congregate settings for people with disabilities. Day, which brings me to another question about staffing issues. How has the crisis in staffing affected the disabled community? Staffing for
I
caregiving.
right. I think one of the toughest things is when you're talking about the movement of people and who and what is doing that and what it turns into. Um, and I think part of that is the idea of all right, who does most of that caregiving. So some of the issue is one for those who do have access to personal care services that are paid, whether through a government program or even private programs, that becomes much more minimized because access to that is either not available or it's done with significant risk. But the other is what you see is family members taking on many of these roles, and that happens actually even outside, but we see that exacerbated by COVID, and that becomes very tough a lot of times on families in general. We always give that statistic about the 1 in 4 or 1 in 5 people have disabilities, but if you talk about how many families have a family member with a disability, that number changes to closer to 1 in 3. So when
Wow.
you add in that caregiving element, we talk about the impact as a ripple on the family. Um, and for good and ill both, there is this expectation that family members will pick up that caregiving role. But when you think about that that only works for folks who have the money and capacity to do that. When you have people who are trying to get by, we heard about retail workers, we heard about folks doing the Uber drivers and the Instacart and all those kinds of things, and they're taking 2 and 3 to try and bring money in. What does that mean when you have a family member with a disability who requires care and services? So all of those things just start to build on each other, and I think COVID really highlighted um, where, from a policy perspective, we have fallen down. Not we've been failing people with disabilities, we've been failing their families because the idea is we exist as a unit. So,
Could you,
and I do want to pause a minute and because we're talking about this, and I know there's a really great point, um, especially we're talking about the perspective of what we call it and who it is, right?
Mhm.
And I know Maria makes a great point about care and caregiving, and I'd love for her to like to expand on that just a little bit, Maria.
Thank you, Day. Yeah, I think it's so important in these discussions that we point out how fraught care as a concept and word is for the disability community. So many of the institutions that we are forced into, so many of the policies that have oppressed us as well as shaped societal perceptions of people with disabilities were created under the guise of care. When you place someone in a nursing home, when you place someone in a group home, it's often under the assumption that this person will be cared for, when really it's in these settings that we see huge violations of our rights and abuses. We also see people being segregated from mainstream community and being segregated in employment and education because the larger world is too dangerous for us and we need to be cared for. And I think we can acknowledge how fraught this is while still pushing for greater dignity and recognition of care work. Because part of this workforce crisis and labor crisis in this setting is because the jobs of people engaged in direct support work and care work have not been valued for how important they are. The average person who works in direct support makes $12 an hour. Part of the reason we have this workforce shortage is because people are leaving these jobs for not only better paying jobs, but also jobs that come with things like health insurance, paid time off, things that should be essential to anyone's career. And so when we talk about people with disabilities and we talk about kind of the care economy, often the word that I use is support. People with disabilities, we all need care. We also all need support. And people with disabilities may need different kinds of support to engage in everyday activities and to thrive in our communities, as we all do. And it is this larger narrative that we need to be cared for that has often silenced us in this conversation. And so I'm really glad that we're having this conversation today.